And I'm going to begin our Nueces County, City of Corpus Christi COVID briefing for this afternoon or for this week. I'll be speaking on behalf of Mayor Guajardo this afternoon, and then following me will be Nueces County Judge Barbara Canales is going to speak as well. Annette Rodriguez, our Public Health Director, will also be providing comment for today's briefing. I'm going to update the community on some of the vaccine drives that we've been doing, the number of persons vaccinated, talk about the week coming up, and talk about the Save Our Senior program. That'll be my portion of this afternoon's briefing. So Nueces County Health District, the City County Health District, has administered over 145,000 vaccines as of yesterday, March 30th. That equates to about 16% of Nueces County having been fully vaccinated, so that's having both shots, if they're having Moderna or Pfizer. So we're about 16%. We still have some ways to go, obviously, right? We want to be at 75% or so. And we've been at this for a couple of months now, right? So there's still a little bit of ways to go before we can relax all our protocol. That includes things like face masks and so on. So 16% of the county is fully vaccinated, and we continue to work to vaccinate even more in Nueces County. This week alone, the City County Health District held 7 vaccine clinics, and we have 2 more to go before this week is over. So this week we had the largest number of vaccines available to administer, and we had the largest number of vaccine clinics that were held this week, and we'll continue to do that as we move forward. We appreciate the partnership of others as well. Driscoll Children's Hospital is one of our hub sites, and they provide vaccines at the American Bank Center. So not only is it the City Health District, but other providers such as Driscoll Children's Health are making a difference in our community. Some statistics or some facts on who's eligible. We're seeing some of those comments still, so we want to make sure people know that the state has really made everybody eligible at this point. There was a phase 1A, a phase 1B, and then we're in phase 1C at this point, but essentially persons that are 16 years of age or older with no comorbidity. You don't need to have a comorbidity or a health issue. All you really have to do is be 16 years of age or older, and you're eligible to receive the vaccine in the state of Texas, and that includes here in Nueces County. You do want to be mindful, though, of the product that you're using. So Pfizer is for persons 16 years of age or older. However, Moderna and the Johnson & Johnson recommend that you be 18 years of age, right? So 16 years to be eligible, but pay attention to the product of the manufacturer because they do have some age recommendations in terms of how young you should be before you take their vaccine. I do want to alert you to a free clinic that's coming up tomorrow, actually, Friday, April 2nd. It'll be from 9 a.m. to noon at McGee Beach, right here near downtown at Water's Edge Park. So on Friday and Saturday, Islanders Women's Volleyball Classic will be held. It's going to be from 8 in the morning on Friday till about 6 on Friday. Numerous 5 colleges, in fact, women's volleyball will be playing right there on the beach, on McGee Beach. And there'll be things like food trucks and other events, DJs and music on Friday and Saturday. But on Friday, because we know there'll be a pretty large number of folks there taking in some of those festivities, they may be off from work because it's Good Friday. This may be a great opportunity for you to get vaccinated. So it'll be right there in the McGee Beach area. Keep an eye out for our signage. We can register you right there on site. You don't have to be pre-registered, and it'll be first come, first serve in terms of the amount of vaccines that we have available. So if you haven't been vaccinated and if you're coming downtown tomorrow, plan on a free vaccine at McGee Beach, and also get in some of that Islanders women's volleyball. There'll be a classic tournament amongst 5 universities tomorrow. Also going on is Mayor Guajardo's Save Our Seniors program, known as the SOS Homebound Senior Program. To date, that program, which was modeled statewide after Governor Abbott heard about it, that program is being used in 98 counties in the state of Texas. and it's tracking to vaccinate about 2 million seniors, the Save Our Senior program that was started right here in Corpus Christi. So in the last 3 weeks, the SOS program here in Nueces County, we've administered about 1,000 first dose vaccines to those seniors that are homebound and can't get out. So we're trying to reach all aspects of our community. An important thing to know is that registration opens tomorrow for next week's SOS. So tomorrow, April 2nd at noon till about 6 o'clock, we'll be registering additional seniors for the Save Our Senior program. Operators will be standing by to assist patrons that want to register, and it's both in Spanish and English, our call takers. So there is a telephone number to call. It's on the screen here. It's an 888 number, so 1-888-728-0018. That's the number you want to call. You can see it on the screen, 888-728-0018, and we'll get you registered for that Save Our Senior program. So that concludes my comments. I just want to, on behalf of the city, as the city manager, but on behalf of the mayor who would normally be here, and the mayor and council, we want to wish everybody a happy Easter weekend. We know today and tomorrow are important days in the Catholic Church, with today being Good Thursday, tomorrow being Good Friday, and then, of course, Easter Sunday. Make sure you continue to follow those COVID protocols when you're meeting with families or groups. We do want to be mindful of that social distancing still. If you're mixing with a group that might be unfamiliar, you might want to wear your face mask depending on who you're around. You also want to pay attention to good hygiene. Continue to wash your hands often and keep your hands off your face and your eyes and your ears. And enjoy the week. And our case numbers, which Annette will talk about, there is a little bit of an increase over the last couple of days, and we don't want to see another significant increase from the holiday. So pay attention to those COVID protocols as we enjoy this Easter weekend. And with that, Gabby's going to translate into Spanish, and then we'll have Judge Canales come up. Thank you.
El condado de Nueces ha administrado más de 145,000 dosis de la vacuna COVID-19 hasta ayer, el 30 de marzo. El 16% del condado de Nueces está completamente vacunado contra el coronavirus. Además, el Distrito de Salud de la ciudad y el condado continúa vacunando a las personas. Solamente esta semana el Distrito de Salud ha realizado 7 clínicas de vacunas y realizará 2 más durante este fin de semana. A partir del lunes 29 de marzo, las personas mayores de 16 años ahora son elegibles para recibir una vacuna COVID-19 que esté disponible. Actualmente, solo la vacuna Pfizer está disponible para personas mayores de 16 años. Moderna y Janssen están disponibles para personas mayores de 18 años. El día de mañana va a haber una clínica ambulatoria del Distrito de Salud para clientes mayores de 18 años. Este se va a llevar a cabo en la playa McGee, ubicada en el 222 de South Shoreline, desde las 9 de la mañana al mediodía. No requiere preinscripción, el registro se va a realizar en el sitio y esta clínica es por orden de llegada. Los clientes también pueden disfrutar del malecón y ver al equipo de voleibol de playa femenino de Texas A&M Corpus Christi. En cuanto al programa para las personas confinadas en su hogar, o Save Our Seniors, SOS, este programa se está utilizando ya en 98 condados en todo el estado y está en camino de vacunar a 2 millones de personas mayores de edad. En las últimas 3 semanas, el programa SOS ha administrado casi 1,000 vacunas de primera dosis. La línea directa de registro para el programa SOS se abrirá mañana, viernes 2 de abril, desde el mediodía hasta las 6 de la tarde. Los operadores estarán listos para ayudar a los usuarios y podrán hablar tanto inglés como español. El número de la línea directa es el 1-888-728-0018. Queremos exhortarle a todos los residentes que sigan manteniendo una buena higiene. Lávese sus manos, use su cubrebocas y mantenga su distancia. También le queremos desear un buen fin de semana por el Día de la Pascua. Ahora los comentarios de la juez del condado de Nueces, Bárbara Canales.
Good afternoon, everyone. Barbara Canales, Nueces County Judge. Well, today is the first day of April, which is literally known, particularly with children, worldwide as April Fool's Day. But I want to be very clear about one thing, that COVID-19 is a topic that is never to be joked about. The coronavirus is still here, as evidenced by the rising case numbers this week. It's still communicable. and it's still causing illness and death, including the one death we reported today. However, on the bright side, we had an incredible week of immunizations. You've heard about our large walk-in clinics at the American Bank Center on Monday and Tuesday. We had drive-through clinics at the fairgrounds. Driscoll Hospital did an incredible job at Del Mar West today. And Nueces County was at Texas A&M Corpus Christi with Christus Spawn, delivering almost 1,000 Pfizer vaccines to students and faculty alike. So thanks to the generosity of all these incredible healthcare providers, including Christus and Driscoll. And the truth is, with university and community college leadership, Dr. Kelly Miller and Dr. Mark Escamilla, these clinics are reaching populations we had not been able to reach before. And how can we ever be so, really, I just don't even know how we could pay the gratitude for the nursing staffs from the universities, from our Del Mar community colleges that have provided a skilled student nursing set to help us at these mega clinics and help us when we're on their own college campuses. This is probably the greatest source of pride that we have in our community. We have also been able to capitalize upon our firefighters and our EMTs countywide. You heard about the SOS program earlier. This was a program that was developed by our own firefighters. It gives us great pride to know that throughout the county, wherever there is a homebound patient, we're able to reach them with this life-saving vaccine in their own home. So clearly, Nueces County has the vaccines, and we have the manpower. So what do we need now? You. We need you. Last week at the podium, the mayor and I passed on the word from the state of Texas that the eligibility requirements for the vaccine were being removed, essentially completely removed. Anyone over the age of 18, regardless of any conditions, were eligible. For the Pfizer vaccine, it's 16 and up. So Moderna, 18 and up, and Pfizer, 16 and up. This opens the door wide open to those sophomores that are 16 and up, or juniors in high school, seniors in high school, and of course, all of our young adults in their 20s, in their 30s, and their 40s. And I said last week, and I'm here to repeat today, this is such welcome news. We are manufacturing and distributing these vaccines in this country in record numbers. And we have set up distribution hubs, such as the ones that we've mentioned before. And we've set up sub-hubs all over our community. The success here at City County Public Health was rewarded by proving that we could distribute as much vaccine as we're given, and we were sent more. And I'm certain when Director Rodriguez takes the podium, she's going to tell us about the exciting allocation news for next week. Vaccines do not sit on a shelf or any freezers in Nueces County. We are good to the last drop. And beyond our hubs, again, we're working with private providers and clinics all over this community to make certain that allocations are given to those who can get the distribution out. In other words, we're looking for arms. We want to vaccinate as many people as we can. I also said that this vaccine eligibility expanding definitely says that when something goes from being very scarce to being very available, sometimes the urgency to have it goes way down. So please, this is a great weekend as you reflect with your loved ones and family. Make a vaccine plan. Make getting vaccinated a priority. I want to be very clear. You are not pushing anybody out of the way that might be more deserving. It's here for all of us. Let me say that again because I like making certain that we get the highlights of why we're here today at this podium. This vaccine is here for all of us, and you aren't taking vaccine away from anyone who needs it more. Remember what I said. We've got the vaccines, we've got the manpower, we're amazing at logistics, we're all over town, we're all over this county, we're all over this region. All we need is you. It's your turn now. So as we logistically come up with new ideas to make certain that vaccines are in your neck of the woods, there's no doubt that psychologically, when people are watching the eligibility expand like this closely, we have had people that have been looking forward to eager anticipation, and those are the ones that come in line first. I don't think we even made it to the 2 o'clock hour at Texas A&M University. So I know there's going to be an opportunity with a lot of people off work because of the holiday tomorrow. Take advantage of the vaccine clinic that you just heard about and watch an Islander volleyball game at the same time. Now that anybody can get this vaccine, you don't have to worry about the urgency or the anxiety of when is it going to be my turn. It's now. Now, this weekend, as was already mentioned, is a special religious weekend, not only for one faith, but for two. It's Easter weekend, and for myself and my family and many in the region, it marks a day when the ultimate sacrifice was made for the benefit of others in our religion. And this giving spirit, that sacrifice, is alive in everyone here in Nueces County, regardless of their faith. And for another important religion, Passover is also with us this week. Literally, the word translates into the time that we know that the Israelites were liberated from slavery. We know that they were saved from the plague in Egypt. And today, we have our own kind of plague, and we want it to pass over us as well, as we seek to also be liberated. So we've come together as a community to defeat COVID in so many ways. We've helped our own brothers and sisters throughout this pandemic. We've made our own sacrifices, literally, so that others may live. For some of us that have been in emergency management and the healthcare world, the sacrifices have been ongoing in a continuous way for over a year now. But I want you to know that you do not need to make any personal sacrifice so that others can get a vaccine. I want to reiterate, it's time now. It's time for you to get this vaccine. It's time for us to remember during this important religious time of year that we have lost so many, that so many have suffered. And if you were one of the lucky ones that COVID didn't affect you, or that you got COVID, but you didn't get very ill, I'm grateful. But for so many families, so many memorials that I've attended lately, it's painful. It's painful to see the suffering of our Nueces County residents who have lost a loved one. Over 700 and almost 50 now. And so I ask you, if there is a sacrifice to be made, and you're just a little reluctant, I want you to think about someone that you love. And I'd like you to consider getting this vaccine for them. As I said, we have everything we need now. I almost feel like I can go, I'm not crazy anymore about fighting for vaccines. They're here. And more and more and more are coming because we've done such a great job. And I'm not worried anymore about how many vaccinators we can get because they're everywhere. From the community colleges and the clinics to our own highly trained city, county public health workers. And I'm not worried anymore about logistics because even though there's things that we can do better here or there, our system is fine. The only thing that keeps me up at night is wondering if everybody will feel like I do. I want to make sure that you understand that what's at stake here is life and our livelihoods. And I want you to get this vaccine because I don't want anybody that you love to have to suffer. And I also want to protect those who have protected us. So my wish for you on this very special holiday, for my family and for our religion, is a very happy Easter holiday, and I hope that you will take to heart all that we have said here today. And as you are thinking about those treasures that gather around your table, whether for Passover or for Easter, that perhaps you will remember the sacrifices that were made in your own community for us all. And a grateful way to say thank you to those healthcare workers is to say, it's my turn. I'll see you next week at the next vaccination clinic. And Annette is reminding me that on a happy note, we talk about good people everywhere. Sometimes they are healthcare workers and you know them because they're an RN or an LVN or a doctor, and sometimes they're emergency management folks or people from City County Health, and then sometimes you just have good people everywhere. Like the lady at Starbucks when I went to get coffee for everybody who was working the Waves Clinic, who wouldn't let us pay for the coffee for 50 people. And as she had tears in her eyes, she said, "Thank you for keeping my workforce healthy. Thank you for being here on the island." And then a friend of a long time of Corpus Christi and a former city council member, David Loeb, printed these shirts for everybody that was receiving a vaccine today. And it says, "I got shot in Corpus Christi, do it for your health." A little pun on words, a play on words here. But we appreciate that because we want to make sure that young people, and we were on the university today, so they loved these shirts. Young people will be wearing these and encouraging their friends to come and get vaccinated. We hope to bring more clinics to our university campuses, our Del Mar College campuses in the upcoming weeks. And we thank David Loeb for sharing the spirit of giving, and I think it's going to make a big impression. So David, from our house to yours, we are grateful for your friendship, for your understanding of the commitment that all of us are making in emergency management and public health, and I know these were greatly appreciated. Thank you so much.
Gracias a la generosidad del sistema SPON y la Universidad Texas A&M pudimos administrar 1,000 vacunas. Estas clínicas fueron posibles gracias también a la ayuda de los estudiantes de enfermería del Colegio del Mar. Le queremos recordar que la vacuna está disponible para cualquier persona mayor de 16 años, no importa a qué se dedique o si cuenta con algún problema de salud. Además de las clínicas, estamos trabajando con proveedores para que más vacunas puedan ser distribuidas, así que le pido que haga de la vacunación su prioridad. Quiero asegurarle que si usted decide vacunarse, no le está quitando el lugar a nadie más. Ya contamos con más vacunas y ahora es su turno. Le pido que aproveche la clínica del día de mañana y si tiene el día libre, acuda a vacunarse. Este fin de semana de Pascua, el cual es celebrado por dos religiones, presenta el mayor sacrificio nunca antes realizado. Le pido que juntos combatamos el virus, el cual nos ha afectado por más de un año. Ahora es su turno de vacunarse. Hemos perdido a muchas personas y muchos han sufrido, pero para muchas otras más es aún doloroso. Quienes han perdido a otros, por lo que le pido que si va a sacrificar algo, considere vacunarse por un ser querido. Considere que lo que está en juego son nuestras vidas. Proteja a aquellos que nos han protegido a nosotros. Le deseo que tenga un feliz fin de semana feriado.
Thank you, Gabby. So we're going to start by going over the Nueces County COVID-19 statistics. And as you see the slide to my right, you see from March 19th to today how the numbers have kind of dipped down, back up, down, and now they're going back up again. So we really need to be careful, and we really need to continue to take COVID-19 very seriously. So I think if you look at March 30th, right here, the 55 number, and you take that out, you're going to see 63, 68, 82, 90. So again, the trend continues to go up, and again, we need to make sure that we're not getting laxed in our behavior and that we continue to practice the public health strategies so that we can all stay safe here in Nueces County. This next slide basically is the pie diagram, and what it shows is that you see a total here, all the numbers added together total to almost 40,000 cases of COVID-19 in Nueces County. It's 39,770, but quickly approaching 40,000. We hope that we never get to that number. Those that were are recovered is 37,930, and then active cases has gone over 1,000 again, 1,091 people active with COVID-19 here in our county, and 749 total cumulative deaths. Our hospitalizations, they seem to be coming down, but we all know that the hospitalizations lag after an infection. And so while our numbers might be increasing, hospitalizations and ICU patients as well as death usually will lag, but they could turn around. That's what we're really watching carefully now. So if you look at the far right side, 50 cases, 50, 52, 52, kind of dips a little bit, and then it goes back to a steady 50 people in the hospital, 50, 50, 50, 49, and then 42. Next slide. These are the ICU patients. These are people that have COVID-19, but they require more care from the medical professionals. And you're also seeing that these numbers are starting to decline. So you have 17 at the end here as of today, but some of these could have passed away, and some of these could have been discharged from the hospital. So the total deaths in Nueces County since last year, March of 2020, is a total of 749. This number will never go down because it's a cumulative figure, so it will continue to rise until this pandemic is behind us. And then the final slide on the statistics are the COVID-19 fatalities in Nueces County over 2 weeks. And what you see is last week, if you cut it right in the middle, where those 3 ones are, right between March 25th and March 26th. Last week, there were 5 deaths in Nueces County due to COVID-19, and this week there's 3 deaths. So that's good news that the deaths are decreasing, but we do know that any death of any person is one that we need to take very seriously because it is a very serious disease. And so my condolences go out to the family of the one individual that died today. It was a female in her 90s. So just kind of pivoting a little bit, the Health District would like to extend our sincerest gratitude to everyone who has opted to receive the COVID-19 vaccination. As of today, the Texas Department of State Health Services has published that Nueces County has administered over 148,000 doses of COVID-19 vaccine. Out of the 148,000 doses, 90,000 have been vaccinated with at least 1 dose. But the more important number is those that are fully vaccinated. And that number is almost 61,000 citizens that have been fully vaccinated. But 61,000 isn't enough people to think that we can all relax the public health strategies, as I mentioned earlier. There are still a lot more people in Nueces County that have not yet received the vaccine. And today, I, on behalf of our community and public health, am encouraging you to please get vaccinated. The Department of State Health Services has allocated over 176,295 doses of COVID-19 vaccine to Nueces County. That means there are more than 20,000 doses still available locally. This could be due to several different reasons. One, we believe there's vaccine hesitancy. You're not sure if you should get this vaccine or not. This vaccine has nothing to do with politics. It has everything to do with the health of our community. If you won't do it for yourself, like the judge mentioned earlier, please do it for your loved ones. Number 2, people have stopped showing up to appointments, which leaves vaccine in our community still available. And number 3, people think that they have had 1 vaccine and that's enough for them. The recommendation is 2 doses for both Pfizer and Moderna. So please make sure you get both doses. The Health District has and will continue to host mega vaccination clinics. We schedule over 5,000 doses each day, but we're seeing a decrease in the number of people coming in. If you aren't showing up to your appointment because you've been vaccinated somewhere else, that's great news. And we certainly encourage you to get vaccinated as quickly as possible anywhere vaccine is available. Right now, we've just opened up our clinics to first and second doses of Moderna to make it easier for anyone needing to get vaccinated. Also, we are aware that some of you have been receiving a reverse alert for sooner than the recommended 28 days for your second shot. Moderna's second dose is due at least 28 days later. If you receive a notification indicating that you are scheduled for your vaccine and you've already taken it or you aren't due yet, please don't come in. This happens because some people have actually registered multiple times, and so our system will just call that number and say it's time for you to come in. We have over 85,000 people in our health district Luminaire system. So again, if you receive a strange reverse alert from us and you know that it doesn't pertain to you, just disregard it. We are doing our very best, but you know better than anyone when your second dose is due. Just calculate a month later. So if you got your first dose March 1st, you know your second dose is due April 1st. It's that easy. If you got your first dose March 5th, your second dose is April 5th. Please pay attention to this since it is very important that you don't get the second vaccine too early. So how do I get into one of the health district's mass clinics? Let's see if I can't make it a little easier for you all. So number one, you can register online at www.cctexas.com/vaccine registration. And this is open all day long, every day. So anytime you're thinking about it and you think, you know what, I really want to go to a mass vaccination clinic, just get online and register. It's very basic information, your name, date of birth, you know, demographics, where do you live, those types of things. And just a few questions just to make sure you're not allergic to the vaccine. Number two, you can call the health department. So Monday through Saturday, you can call us, and the number is 361-561-1101. And if you're having trouble with your computer or with your internet, we will register you for you. So that way you can come to one of our next clinics. Or number three, you can just drop in. Just come to the health district mass vaccination clinic. Just drop by, and we'll go ahead and get you registered there on site. I would also remind you that many other providers in Nueces County and the city of Corpus Christi are also able to provide the vaccine. Get vaccinated today and help save a life. You never know, but it could be your own. Today, I'm excited to say we received 7,000 first doses of Moderna. So for next week, which is an increase of 2,000 doses from our regular 5,000 that we receive weekly. We were also notified today that we will be receiving 3,000 doses next week, in addition to the 7,000 of Johnson & Johnson. J&J, one and done. You get one vaccine, and that's it. It's over. So that's really great news. So there'll be plenty of opportunities to get vaccinated. Please don't miss out. May you be blessed this Easter season with good health. Stay protected at your Easter celebrations. Continue to wear masks and social distance around strangers, and stay informed. Thank you very much.
En las últimas 24 horas se han reportado 90 casos confirmados por el coronavirus. La tendencia de las últimas cifras va hacia arriba, así como los casos activos. 42 personas continúan en el hospital, 17 están en la unidad de cuidados intensivos. 1,091 personas son casos aún activos. El día de hoy se reporta un fallecimiento. A la fecha, los fallecimientos totalizan 749 personas. Queremos agradecer a todas las personas que han decidido vacunarse. El condado de Nueces ha administrado más de 148,000 vacunas, 90,000 con una dosis y 61,000 vacunados con las dos dosis requeridas. Esta cifra aún no es suficiente, por lo que le pedimos no bajar la guardia. El Departamento de Estado ha asignado 176,295 dosis al condado de Nueces. Eso significa que hay más de 20,000 dosis disponibles localmente. Creemos que existen varias razones. La primera, mucha gente no está vacunándose debido a razones políticas. La vacuna no tiene nada que ver con la política. Le pedimos que se vacune por sus seres queridos. Segundo, la gente no ha acudido a su cita fechada. Y tercero, la gente solo está recibiendo una dosis. Les recordamos que las vacunas Pfizer y Moderna requieren de 2 dosis para que sean efectivas contra el virus. El Distrito de Salud va a continuar teniendo clínicas diarias de hasta 5,000 vacunas. Esperamos que si la gente no está acudiendo con nosotros, lo hagan en cualquier otro lado en donde le ofrezcan la vacunación. Nosotros estamos ofreciendo la vacuna de la compañía Moderna, cuya segunda dosis debe recibirse después de 28 días y no antes. Si usted se registró en más de 2 ocasiones, va a recibir varias notificaciones. Le recordamos que solo debe registrarse en una sola ocasión para recibir las 2 dosis. Para registrarse hemos facilitado la información. Puede hacerlo llamando al 561-1101 o en línea a la dirección www.cctexas.com/vaccine registration. Esta última está abierta a las 24 horas. O simplemente puede pasar por una de nuestras clínicas y lo ayudaremos a registrarse en el sitio.
Thank you. Seeing that there's no questions, thank you for being with us today. Happy Easter, and we'll see you again next week. Thank you.